in some instances, the viruses that were identified or viruses that could contribute to foot and mouth disease. But we're watching these areas also. It goes to show the amount of surveillance that we have now available, and the fact that our Fiji CDC laboratory is actually, really grown from strength to strength. The other thing is that the world is actually at the moment also, monkeypox has been declared a public health disease of emergency or of concern, similar to what COVID-19 and also polio has happened. So all these communicable diseases, they are again in greater numbers in certain areas around the world. So there are countries around the world that have got a fair bit of monkeypox. We haven't had any countries that have foot and mouth disease. There are countries that are struggling with COVID-19, and there are countries, like us, that has had a few cases of measles that we picked up recently. We had a bit of COVID-19, but not really significant numbers that warrants us to have very stringent public health, restrictions that we've had in the past. We're able to enjoy this at the moment because of our strong vaccination campaign that we have and the layers that are in place. I think that's important to understand. So once we are going through our normal business, the Ministry of Health staff, working with our partner organizations, are watching the spaces, taking swabs, testing, and watching what's happening in terms of the microorganisms that are that are emerging threats throughout the region all around the world.
Conditions of this?
At the moment I haven't received that what the conditions of the patients are. What I do know is that if they are any, they are well, but we've identified them because we've the surveillance systems that we have in place. As I've alluded to, somebody presents to the health center or health facility, the doctors now have a template to use. And that template actually helps them to identify whether that person needs testing for what particular diseases that we may think can be happening, including leptospirosis, typhoid, and dengue. And the testing mechanisms are available, either the handheld, the tests that are available through reagents at the health centers and hospitals, or the testing is available by taking samples and bringing back to Fiji CDC. The high-end stuff, like the genomic, sequencing, in which we've been able to pick up that variant that you've talked about, that only happened because we were concerned about it. We were able to send it offshore to our reference lab.